Are you ready? Wake up, Lehigh Valley, Warminster, Philadelphia. I'm Chris.
I'm Danielle.
I've got coffee.
I've got questions.
Yes, so we're here to answer your questions that you asked us on our Instagram on Monday. We posted a story. We asked you to ask us questions. I've got 30 questions. Some of them are repeats, so we're going to go through them. And do you want to hold them up real quick? So these are literally your questions, guys. You've asked these. We've got dozens of pages of them. So let's get right into it. Are you ready?
Yeah.
Okay. Question 1. Wait, can you post the filler versus Botox image? Like, yeah, I'll post that right here. Bing. Okay, so that's for people who want to know where Botox is best versus where filler is best. 2, do you ever inject Botox in the chin?
You can. So some people get the little dimple chin when you go like this. So if you see you get little dimples here, you can inject those muscles and relax it for you.
How many units?
Like 6.
Not bad. So that'll last you the same 3 to 4 months. But remember, areas that move more, so things like your lip lines, or a lip flip, or your chin, if you move it a lot, might eat through the Botox quicker. Mm-hmm. Is there an alternative that lasts longer than 3 months?
So no,
Not
but
yet.
the good thing is I tell clients dose equals duration. So if you're dosing appropriately and you do a little bit of a higher dose, you should actually get, it's been proven to last a little bit longer.
Cool. And so we keep hinting at the 6-month Botox that's supposed to be coming in November, which is in a month. Mm-hmm. Probably not going to happen. Due to COVID, the FDA is really backed up. But we'll keep you in the loop.
Yep.
Do you do masseter Botox?
We do.
Stop. What's a masseter?
So it's actually the muscle when you clench here. I tell clients that they take their fingers, and if you clench and you feel your fingers go outward,
I'm not putting my coffee down for this.
then you're actually a candidate for masseter muscle injection. So you may have TMJ, you may just have tension in the back of your jaw here. So if you notice that you get headaches or you grind your teeth a lot, or when you do this and you see your fingers move outward, then you'd be a great candidate. And it'll help slim your face too, which is nice.
How many units are typically needed for preventative Botox? That's a loaded question.
It is. So I can't really give you an answer for that. You can come in and have a really strong muscle, but just not have static lines yet, or you may have very, very minimal movement and you're just looking to maybe start it, so it really can range.
So like consultations are complimentary.
Yeah.
And you can also send us pictures, but if you're gonna send us pictures for a consult, we ask for expressions, right? So raise your brows, angry face, relaxed, and a smile, and that'll help us give you a better quote. This is a tough question. Do you use Botox or filler for wrinkle prevention around the lips and nose area? Both?
Yeah, nose would be Botox for your bunny lines up here. If you did filler, that would be more of a non-surgical nose job. The lip lines, you could do both. Usually I start with a neurotoxin to relax the lines, which is also known as lip flip. But if you really do have static lines above the lip, you may need filler as well.
Perfect. We're still on the first page, guys. You better grab a coffee, better pause us and get some popcorn. How long do you have to wait after a peel to do Botox? I'll take this one. I say Botox 2 days before, or a Botox 2 weeks after a peel. So you can do Botox and a peel. I'll let some people do it on the same day, right? If you're driving from very far, but you peel first. So visit Kelsey or Kaylin or Elizabeth first, get your peel. Mm-hmm. Not with the Enlighten peel though, that's the orange face one. You can't do Botox with that. But then you come visit your injector. But if you're doing them on separate appointments, Botox first, 2 days later you can do a peel, or peel and then 2 weeks later do the Botox.
You don't want to be peeling because it can make your skin taut.
Can you do Botox under eyes? If there are bags, no, but...
If you have crow's feet that extend even a little bit below your eye, I can bring it a little bit farther down. We call it microtox, so you can dilute it a little bit so it's softer. So it can help with the lines, but it won't help with the hollowing, the teardrop area.
Do people, this is the same, two different people ask this question right after another. Do people become resistant to Botox over time?
So I've actually been educating clients about this, because if I see a client come back in before 2 months, then I'll tell them you don't want, even if you're just starting to notice a little bit of movement, right? That's normal. You will start to see some movement around the 2 month mark because it slowly comes back. You don't just wake up and all of a sudden, your wrinkles are fully back. But around 2 to 2.5 months, I don't want you to come back in just because you're slowly seeing movement come back, because that's normal. If you dose to soon, then yes, you can start to build resistance because you're going to start to get some antibodies, and you don't want that. So you really should be waiting about 3 to 4 months.
And if you do build resistance to the brand name Botox, you might have better luck with the alternatives, Dysport or Jeuveau.
Which was another question, I think,
Would it be recommended to get Botox in the forehead before or after a thread lift? I have my opinion. What's yours?
I would say do the thread lift first because you're going to see your final results, right? So then once you see what kind of lift you get, then you may not want to do the Botox brow lift. So
my answer is very similar but flipped. I would do the Botox first. Only because it's a little more affordable. So see what you get with the Botox.
You probably get a better lift though with the
threads. That's what I'm saying.
Yeah.
People always ask why are threads more expensive? They're more dramatic. Plus, more equipment goes into them.
Yeah.
How do you know if you have a Botox allergy? We just looked this one up because we'll be honest with you, it's never happened in our office.
Yeah.
But of course, our injectors are all versed in what it looks like. You will get bumpy right after Botox. That's normal. Those go down within 20 minutes. We've had some people develop, this is super rare, an internal bruise from a Botox bump. Goes away as well. If you were to be allergic, it is not life-threatening, so don't panic. It would be an itchy forehead. You'd break out into hives, and you would get treated with an antihistamine. But again, it's super rare. Have you ever seen it?
Yeah, no, the most common thing I'll hear of is maybe a little bit of a headache, and that's really it.
And the headache comes because your body has been so used to scrunching for a while that when you can't, your body's like, oh, this kind of hurts. You're trying hard, you know? Why can't you put Botox on the side of your cheek in those smile lines, dimple area? So nasolabial fold, yeah.
Okay, so that would be filler. So when you start to lose some bone loss and fat pad loss, everything does start to fall forward a little bit. So what you're seeing here is actually loss of volume. So we would need to restore that volume with some hyaluronic acid.
This person says, hi, I love your stories. So thank you so much.
Thank you.
This was a good one. How often did you get Botox?
Every 3 to 4 months. Some clients, if they do metabolize it a little bit quicker, I do see them like at the 3-month mark. But if it's someone that maybe can get, I don't know, like 3.5 to 4 months, then usually they keep on that as well. Are you taking
I took a picture of us doing this video so I can post it later to be like, hey guys, we recorded this video for you. All right, I'm always thinking. This is not related to Botox, but we'll answer it anyway. Why do some people get the Simpsons lip? There's like duck lips almost.
Yeah, if they're overfilled or poorly placed, that's usually the reason.
Do your research before picking a lip filler person.
Yes.
Do you get the same amount of Botox each appointment, or do you need less and less each time?
So that varies as well. A lot of clients get a dose and they're good with it for a few months or a few years, and then sometimes we can decrease it because we've atrophied the muscle, or sometimes over time you actually do need more. So it really just depends on the person and how long you've been getting it.
Be true. We always say if you stick with it, you'll probably need less, but the keyword is probably. Yeah. And not a guarantee.
And you know, you're also can be comparing someone who's been getting it for 20 years versus someone who's been getting it for, right. Yeah. So
do you numb before a Botox treatment? If not, could that be an option? Not really. Some clients request ice before to kind of like cut down a little bit of I can't even call it a pinch.
Yeah,
it's really you don't feel it at all. Are there any side effects if you stop getting Botox all of a sudden?
No, you'll just gain the muscle movement back, so the lines will just slowly come back over time.
So we always say, I refer to the movie Titanic, right? If you are watching Titanic and she's just about to hit the iceberg and you get Botox, aka push pause, you're good. That VHS will never go again. But once you stop getting Botox and or push play, you're hitting that iceberg, you're gonna start aging again, right? So there's no side effects to stopping other than aging. Is aging a side effect? I would say so. What's a good age to start getting Botox? Oh, wait, let's both say what we think on the count of 3. Okay, ready? 1, 2, 3. 25. What?
I was 21 with wrinkles.
Oh,
I
God.
had a line
you are
here.
Ancient. You're gonna look great forever then.
It depends though.
It really
depends
does.
on the person.
It really
I have
does.
strong muscles.
So the answer is when you feel like you need it,
Yeah.
but you have to go over your team. Okay.
Yeah.
Why do people get Botox rather than Dysport? Brand name is one of the reasons. I mean, some people will go ask for a Coke at a restaurant and then take a Pepsi, it's fine. Other people say I need a Kleenex, but it's really a tissue.
Rewards.
It's rewards, so Allie is coming soon, Brilliant Distinction Rewards. It's loyalty, they've just been doing it for so long. It's also, up for debate. Some people think that Dysport spreads a little more, giving you a softer look that lasts longer, whereas Botox gives you a tighter look that doesn't last the full 3 to 4 months. But we can't verify that.
It's really
it's
dosing,
really different.
though. It really does come down to dosing.
Dosing equals duration.
Love that quote.
This girl, another, has not had an allergic reaction. It's my biggest fear. No, guys, you're good. I say
fine.
that. But like, I actually have had 3 patients in my 10 years here ask for 1 unit of Botox to see if they had a reaction.
Really?
All 3, yeah, true story. All 3 of them didn't, and they came back for full doses. If I have chubby cheeks, what can Botox do for me? We talked about that, TMJ. I just got my crow's feet done 4 days ago by Michelle. When should I book a follow-up? You only need a follow-up if you don't see change. And Danielle, how long should we wait to see change?
At least 10 days with Botox.
10 days. When should I get it done before my wedding? July 23rd, 2021. So,
Okay, so if you've never had it before, I'd want to do 2 treatments. Yeah, so plan at least
January.
6 to 9 months in advance, because I want to get a good dose down, and also before the wedding, I don't want to do it right before the wedding. I want some wiggle room in case we have to do a touch-up.
Yeah, what if you hate it? Then you're stuck on your wedding day.
Don't
But
listen
I'm just saying, like, at least you know. It also will help with those static lines, right?
Yeah.
We talked about how my expression, you like the duration equals
Time or dose
duration. I really like that it took you 20 to 30 years to make these lines. I need more than 1 Botox treatment to erase them.
Yeah.
So, you know, start when you feasibly can, budget-wise. How to explain Ooh! Welcome to the Maury Show, where today we're talking about how to explain Botox to significant others and mothers who are judging and disapproving it. Girl, let me be your gay best friend.
Aging beautifully.
No, let me be your gay best friend. Screw them. You don't need to listen to no matter what they say. No, but seriously, has anyone ever made fun of you for doing Botox?
No, they want to know more about it.
So what I would say to your significant other or your mother is 2 things. 1, you're crunching my leg. Danielle was moving the automatic chair into my leg. I would say to your mother, Mom, this is how I choose to age gracefully. I'm not doing this for anyone but myself. If you're feeling a little saucy, I don't want to look like you when I'm older, Mother. Wait,
you should insert the picture of the meme from the Golden Girls versus Jennifer Lopez.
Yes. Which one how do you want to look at 50?
Yeah.
And to your significant other, I mean, if you're sharing a bank account, maybe that's another story, but it's your life, girl.
Do you?
Do you? What does it cost? Well, glad you asked. It's sold by the unit, so it could be anywhere from $100 lip flip up to $600 for a man. But most people, I say, bring $300 to $400.
Yeah, average.
Yeah?
Yeah.
You can start lighter. You don't have to. Where do you recommend getting Botox for prevention? Anywhere you're seeing lines?
Yeah, usually I see prevention starting in between the brows here, so your glabellar and the frontalis, but it can really be anywhere, crow's feet.
Can you get a brow lift and smooth out forehead wrinkles, or is it one or the other?
You will get some lift if you do your forehead and in between your brows, but if you want that extra little pop, I'll do a little bit at the tail end of the brow.
Does Cigna ever cover Botox for teeth, clenching, or TMJ?
We don't take it.
We don't. So I looked at you as if I expected you to answer, but I had the answer for this one. So we don't take insurance. We are 100% a medical spa, so we do not take insurance. We have people who've used their PPE.
Oh, the HSA
cards.
account?
Yeah, HSA accounts. We can swipe that like a card. That's fine. But I can't write you a letter to your insurance to get it covered. That's just not what we do here. We made it to the end of the questions.
Oh, wow.
I think we should give something away.
I was just going to say
do that? Okay.
Yeah.
So
let's ask them a question.
I was going to see, this is a 14-minute video. So I think that we should see if they made it to the end.
Okay. What is Isabella's middle name?
Well, you have to give them the answer.
The answer is Rose.
Okay, so then you guys can comment below either an emoji, the rose, we'll know, or the word rose, but don't tell anyone why you're commenting that. It's only for people who've made it to the end of this video.
People would be thinking flowers. Why are there so many flowers?
So if you made it to the end of this 14-minute video, which I now have to edit with my little curse word out, rude Balby.
I made it, no cursing.
Jackie is who I worry most about. All right, so we're going to wrap this one up because Danielle has a full day of clients. You guys continue to stay safe, continue to stay healthy, continue to comment the rose picture. And this will be posted on Thursday, so have a happy weekend.
Yeah.
And if we left out any questions, let us know.
Yeah.
Danielle's here. You can find her Instagram handle here. And you can always enter a DM, but please, like, you can DM us too. We're good at what we do. Okay, bye.